Like you'll see when we look at ClinCheck, you'll see like this guy right here, I couldn't do his implants right away because I wanted to expand that arch and get things kind of in a relative position before I put the implant in. But once I was done getting those front movements done, I had the surgeon put the implants in and then kept expanding and aligning his teeth. And really it's just a matter of expanding like that and setting up, you know, the occlusion to accept the implants. And he's almost done. I actually just scanned for his implants and did his crowns as well. Notice I don't do the crowns or the implants until I address the occlusion, right? It's like you got to do the foundation. It's like building a house. You're not going to be building a house unless you got a good foundation. So those are scan bodies with the iTero that I use to restore my implants. And there's my preps on the bottom. And you can see that he's going to end up with, you know, healthy implants, everything straight, healthy occlusion, and about a $20,000 bill. It's pretty expensive stuff. Maybe more, actually, when you look at the surgery. Same thing here. This patient came to see me, and you can see she lost that molar in the upper right first molar. Horizontal fracture. She came in. You ever see those teeth they fracture and they're both sides are going like this? And you like look down a cave and you're like, this tooth's a goner. So I'm like, you know, you're gonna have to get an implant here. And posteriorly, you know, her bite is class 1. She's not that bad, right? But I know that she's got to have the tooth out. She's got to get grafting, and you know about how long that takes is about 6 to 9 months, right? Right? So I'm like telling her, okay, we gotta get an implant. It's gonna take 6 or 9 months. But I'm like, let me look at your, you know, let me look at your mouth and your bite. So I looked at her mouth and her bite. I did a scan and I looked at it, and look at the incisal edge of 9 and 10. Do you see the enamel missing there? And then what kind of bite is that? What?
A little bit open on 7.
How would you describe the bite? Come on, you guys know now.
End to end.
It is end to end, yeah. But remember, we start with the three realms of space. So class 1, I told you she was class 1. So it's class 1, right? Edge to edge bite, narrow arches with moderate crowding. Everybody see that? Make sure you take your pictures, mark your midline, and you see her midline is off a little bit. So I'm going to do a little bit what's called IPR, interproximal reduction, where I go through those teeth and I make them a little bit narrow so I can shift them over a little bit and correct her midline while I'm doing her expansion. So that's where I want her to end up. See how I correct the midline, lessen the deep bite, get better overbite? You see that? And this is what it looks like when you expand teeth. That's like that's the movement right there, right, Doc? And how easy is that? It's a cakewalk. That's Invisalign Go stuff, you guys. Push those teeth out is so easy, and make ideal space for your implant to go in there. Same thing on the bottom arch. That's expansion. That's what it looks like. You see, you guys, when you push those teeth out, how it creates more arch length? And it creates ability to align the teeth up. Remember, 80% of Invisalign is what? Uprighting and pushing forward. That's all it is. It's not rocket science. And once I had her aligned like this, now I'll put my scan body in and then restore her implant. And in the end, she ends up with what? A healthy occlusion that looks better. The implant's in a better functioning occlusal environment, and I've double dipped because I've done Invisalign and an implant all at the same time. We call that double dipping. You guys like production, you're a doctor, learn, you know, you gotta do this stuff, right?
And drive-by profies.
Drive-by profies. Check this out. This is what time lapse looks like. So I scan the patient on when she was a first patient, before she fractured the molar. I did a scan of her, right? And then I did another scan with her scan body to create her implant crown. Now watch, see the healing cap there? I'm going to move that magnifying glass over the healing cap and watch how it will go from where she had the tooth to where she had the healing cap. I'll move it back a little bit for you. There you go. Isn't that cool? So that's an example of taking a scan prior time, using time lapse, and then seeing something where it's changed. And remember, when it's changed, what color does it give you?
Red.
Red. So look, it's like fire red there, right? So how can you miss that? Okay, this is 31 aligners. This would be a deep bite case, 31 aligners on an older patient. And this is the patient that wanted remember that first case I showed you, that Maui patient, she wanted the implant, she saved up money. She said, I got money to do the implant, Dr. Coddington. And I said, we're not doing the implant until we fix your bite. And her thing was, my front teeth are crooked, I don't see them in pictures because they're retroclined. She's like, you know those class 2 division 2 where the front teeth are pushed back? And when you take a selfie of someone with class 2 dip 2, you cannot see their incisal edges, so it looks like they don't have teeth. And then she needs an implant. That's what she told me, right? Remember when they tell you their chief concerns? You got to make sure you address them, right? Someone comes to see you in Invisalign and they have a big diastema, and you fix all their bite perfect, but you leave a diastema, you failed. You got to pay attention to their chief complaint, right?
Does the number of aligners correspond to the number of weeks generally, or?
Yeah, no,
or is
totally,
it
yeah.
1 to 1, one aligner to 1 week?
I'm going
or
to
is
go
it-
over that because
Okay.
Invisalign Go, all of that treatment is you change aligners every 7 days
Okay.
because they're simple green movements. When you have an older patient like this, I can't remember if I did 2-week wear on this, but we go between 7 and 2-week wear based on the age and the difficulty of movement, which the ClinCheck tells you.
All right.
So you're using 2-week wear on cases that are older, complex movements, and 7-day on easy ones, right? Yeah. Same with you, right, Doc? Yeah. So you can see, look, remember class 2 division 2, how do you treat it? You just push those front teeth forward and expand the arches, and then set up for your implant. And this was 31 weeks because a little older patient and a little more advanced type of movement, right? But an older patient can be treated with Invisalign, is my point here. And now you can see her teeth when she smiles. Here's another case of, we're 20 minutes to lunch, hang in there. Here's another case of doing, addressing occlusion before doing implants, right? So this patient came to see me, she lost, this was baby tooth K that failed, and then she cracked that molar. So she came to see me as a new patient, she needed those teeth out. We wanted to do implants. She's also class 2 division 2, but here's a sample of that. You don't need to correct the AP because periodontally she was healthy with the class 2, right? And you can see she's end on end class 2. That means when the molars are stacked right on top of each other, right? You can see she's end on end class 2. Div 2, remember the flared laterals and retroclined front teeth is class 2 division 2. So what I'm going to do here is I'm going to do her implants, but while I'm doing the implants, I'm going to work on the occlusion because look at that. Look at her bite. Narrow arches. How do we describe this bite? Who wants to do it? You do it, Doc.
Okay, so class 2, division 2, we talked about that. Overbite looks pretty normal there.
Right.
Let's see, overjut's minimal.
Is there a cant from the one side?
What's the severity of crowding?
Mild.
Don't overthink it too much. Look, it's just
Moderate
class.
to severe.
You just do this. Look, it's class 2 end on end, class 2 div 2,
Okay.
narrow arches, moderate crowding. That's it.
That's end on end?
Huh?
It looks like they're so.
End on end means the molars are right on top of each other. See the first molars?
End to end biting.
They call it end on end class 2. If it was back a little bit, it'd be like a quarter step class 2 or a full step class 2. Okay, so this is where I want to get her because I'm more interested in fixing, this scenario right here and correcting her deep bite as well because she is doing some severe wear on these lower anteriors. So the staging of this is to take out those failed teeth, get them grafted, get them to the oral surgeon, get her to the oral surgeon and get the implants in place. And then while the implants are there integrating, then I'm doing my alignment, right? And once I've got my alignment, then I can go ahead and do my scan bodies and restore the case. And you also see, like, I'm not going to restore the crown until I restore the implants because it's all at once, right? You don't do any crowns on patients that have bad occlusion. I know this sounds crazy, but if someone comes in and they've broken a cusp off a tooth and they've got like a crossbite, I will prep the tooth and cement it temporary permanently, do a few months of Invisalign, and then make a permanent crown into a perfect bite. It's a lot easier, you guys. So here's where she finished. So she's got her teeth in place and she's looking a lot better. And her bite is a lot better. This case is kind of cool, Invisalign before restorative, because this will show you the power of using Invisalign to your advantage when you do a restoration. And this gal was, you remember this case, Doc? Good.